$1,600 hits your account every month. In Vietnam, that can still cover a comfortable basic lifestyle. In Thailand, the same $1,600 can disappear much faster once you add better housing, healthcare, and the costs of maintaining legal long-term status. But here's the part most retirement videos completely miss. Vietnam may win the monthly budget, while Thailand wins the retirement security test. So which country actually works better on $1,600? We're going to test both on the same three things: your money, your visa, and what happens when you need a doctor. The 2026 reality check. There was a time, not that long ago, when both Vietnam and Thailand were marketed as almost impossibly cheap retirement destinations. And the content that came out of that era shaped the way most people still think about both countries today. Cheap rent, street food for $1, healthcare that costs a fraction of what it does back home. $1,600 a month and you're living like royalty. That framing wasn't entirely wrong. It was just incomplete. And the parts it left out are exactly the parts that matter most once you're actually retired and living there. Here's the 2026 reality. Prices vary dramatically by city, by neighborhood, and by lifestyle. What costs $400 in one part of Vietnam costs $900 in the expat-facing part of the same city. What worked for a 35-year-old remote worker in 2018 does not automatically work for a 68-year-old retiree managing a chronic condition in 2026. Retirement isn't just rent and food. After 60, healthcare access and immigration stability become the variables that determine whether your retirement actually works, not just whether it's affordable on paper. So today, we're testing both countries against a real $1,600 monthly budget across 4 pillars: housing, food and daily life, healthcare, and visa stability. By the end, you'll have a clear answer, not a vague "it depends," about which country actually works for your specific situation. Pillar 1, rent. Let's start with the number everyone looks at first, and let's start in Vietnam. Specifically, Da Nang, which is where most serious retirement research on Vietnam eventually lands. It's not Ho Chi Minh City's chaos. It's not Hanoi's cold winters. It's coastal, it's manageable in size, and it has enough expat infrastructure to make daily life genuinely livable for an older American. Now, here's the mistake people make about Vietnam rent. They see a $200 apartment listed online, and they build their entire budget around that number. And then they arrive and realize that $200 apartment has no elevator, is 3 kilometers from the nearest decent hospital, and has the kind of building condition that's fine at 30 and genuinely problematic at 70. Here's the reality for a retiree. Not a backpacker, a retiree. Elevator access matters. Proximity to healthcare matters. Building condition matters. And here's the thing nobody puts in their Da Nang retirement video. The difference between a livable retirement apartment and a budget apartment isn't just comfort, it's safety. It's the difference between being able to get yourself downstairs during a medical event and not being able to. It's the difference between a 10-minute walk to a clinic and a 40-minute taxi ride. Those details don't show up in a rent comparison chart, but they show up in your life every single day. A retirement-appropriate apartment in Da Nang, one with an elevator in a reasonable location near medical facilities and daily necessities, costs more than the $200 number that gets passed around in expat forums. That's the honest starting point. The fix is not to abandon Vietnam on rent. It's to look outside the most expensive beachfront buildings, prioritize accessibility over address prestige, and build the rest of your $1,600 budget around realistic housing, rather than a number that exists in content from 5 years ago. Now, Thailand, specifically Chiang Mai, because Bangkok on a $1,600 total budget is a conversation that ends very quickly. Here's the mistake people make on Thailand rent. They see a $400 advertised apartment and assume that's the monthly housing cost. It isn't. Utilities in Thailand, and I want to be specific here, air conditioning, electricity bills in a tropical climate are not a minor line item. They can push your real monthly housing cost significantly higher than the advertised rent suggests. Building fees, internet, the actual cost of running an air-conditioned life in a hot country. Add it up before you commit. Chiang Mai is the stronger Thailand option for a strict $1,600 total budget. Bangkok becomes nearly impossible unless you're keeping housing costs unusually low and living in a way that most Western retirees find genuinely uncomfortable. A $200 or $300 monthly difference in rent sounds manageable in the abstract. On a fixed Social Security check, that difference is your healthcare budget. That difference is your emergency fund contribution. That difference is the margin between a retirement that works and one that doesn't. But rent isn't where this comparison gets really interesting, because you can adjust rent. You can't as easily adjust what comes next. Number 2, food and daily life. Vietnam first. And this is genuinely where Vietnam shines brightest for the budget-conscious retiree. Local food in Vietnam is one of the most compelling financial arguments for the country. Markets and local restaurants can keep your food costs remarkably low. A bowl of pho that costs $1.50, a banh mi that costs less than $1, coffee culture that makes your daily caffeine habit genuinely affordable. And here's something that doesn't get said enough about Vietnamese food specifically. It's not just cheap, it's genuinely good. This isn't a situation where you're sacrificing quality for cost. Vietnamese cuisine is varied, fresh, and built around ingredients that are locally grown and locally priced. You're not eating cheap because you have no choice. You're eating well because the local food culture happens to align almost perfectly with what a retiree on a fixed budget needs. That combination, low cost and high quality, is rarer than people think when you start comparing retirement destinations seriously. If you build your food budget around local eating, the way Vietnamese people actually eat, your monthly food spend can stay very low and still be genuinely good food. The problem appears the moment you stop eating locally. Imported American products carry significant price premiums. Western restaurants in expat areas in Da Nang or Ho Chi Minh City charge Western prices. The gap between eating like a local and eating like a tourist in Vietnam is one of the widest of any retirement destination I've covered on this channel. The country rewards adaptation. It penalizes the retiree who's trying to recreate their American grocery list in Southeast Asia. The fix is simple in principle and harder in practice. Build the budget around local food. Treat Western restaurants and imported products as occasional spending, not daily habits. Thailand. And this is where Thailand's food situation is genuinely more complex. The range of options in Chiang Mai is extraordinary. Local food is excellent and affordable. Thai supermarkets stock a broader range of Western products than you'll find in most Vietnamese cities. The food infrastructure for expats in Thailand is more developed, which is both an advantage and a trap. The advantage? You have more choice. The trap? More choice means more temptation to spend. Expat neighborhoods in Thailand can be significantly more expensive than local areas. Delivery apps, Western chains, the quiet inflation of convenience spending. Thailand makes it easier to live comfortably and easier to accidentally spend more than you planned. And I want to be honest about something here that rarely gets discussed in these comparisons. The expat lifestyle creep in Thailand is real and it's fast. You arrive planning to eat local. 3 months later, you're ordering delivery 4 nights a week and grabbing coffee from an international chain on the way to the gym. None of those individual decisions feel significant. Together, they can add $200 or $300 a month to a budget that was already tight. Thailand's food environment is genuinely excellent. It just requires more active discipline to keep costs where you planned them. The verdict on food. Vietnam has the stronger edge for a strict $1,600 budget. Thailand can work, but it requires the same discipline Vietnam requires, with fewer environmental signals pushing you toward it. And if food is where Vietnam wins most clearly, Healthcare is where the comparison flips entirely. Number 3. Healthcare. Let me tell you how this section usually goes in retirement abroad content. Someone lists the price of a doctor's consultation in Vietnam, maybe $20, and presents that as evidence that healthcare is cheap and good. And then they move on. That's not healthcare planning. That's a single data point dressed up as a conclusion. Here's the honest picture for Vietnam. Major cities, Da Nang, Ho Chi Minh City, have modern private hospitals and clinics that can handle routine care competently. A standard consultation is affordable. For day-to-day health maintenance, Vietnam works. The problem appears when you go beyond routine. Specialist access varies significantly by location. Serious medical situations, the kind that actually threaten your life or your finances in retirement, may require treatment in a major city regardless of where you're living. And international health insurance, which you will need because Medicare generally does not provide routine coverage in Vietnam, becomes more expensive every year you get older. By the time you're in your late 60s or 70s, that insurance line item has grown into something that meaningfully compresses your $1,600 budget. Thailand is a different conversation entirely. And this is where I need you to really pay attention, because this is the variable that changes everything for retirees specifically. Thailand has built one of the most developed private medical tourism infrastructures in the world. Bangkok and Chiang have internationally accredited hospitals with English-speaking staff, modern equipment, and experience treating Western patients. This isn't just good for Southeast Asia. Some of these facilities are genuinely world-class by any standard. For a retiree, someone who statistically will need more medical attention over the coming decade, not less, that infrastructure difference is not a minor comfort. It's a fundamental quality of life and financial security variable. The problem is cost. Better medical infrastructure means higher private care costs. Insurance in Thailand becomes more complicated and more expensive with age. Pre-existing conditions, coverage limits, exclusions, these matter in Thailand in ways that a $20 consultation price in Vietnam doesn't prepare you for. Here's the honest summary. Vietnam can save you hundreds every month on healthcare costs in the near term. Thailand can give you significantly more confidence when something actually goes wrong. And after 65, that difference matters in a way that's very hard to put a dollar figure on until you're actually facing it. Which brings us to the variable that determines whether any of this is even legally possible long term. Pillar 4, visa stability. This is the section that most cheap retirement videos skip entirely, and it's the section that matters most for anyone thinking about a 20-year retirement plan rather than a 2-year adventure. Vietnam. And I want to be direct here because the situation is genuinely important and genuinely misrepresented. Vietnam does not currently have a dedicated retirement visa. The e-visa allows stays of up to 90 days. Long-term retirees need another qualifying legal basis, an investor route, a family connection, or another qualifying category to maintain legal residence beyond that framework. What that means in practice, Vietnam is an excellent country to test, to spend time in, to genuinely experience before committing. It is less straightforward for someone who wants a simple retirement residence permit based purely on age and pension income, because that permit does not currently exist in Vietnam the way it does in some other countries. And I want to sit with that point for a moment because I think it gets glossed over constantly in content about Vietnam retirement. People move there, they love it, they start building a life. And then somewhere around year 2 or 3, they start asking questions they should have asked before they arrived. What happens if the visa rules change? What happens if my current arrangement stops working? What's my legal fallback? The retirees who ask those questions before they move make better decisions than the ones who ask them after. Vietnam rewards the retiree who does the legal homework up front. It is genuinely unforgiving to the one who assumes flexibility will always be available when they need it. I will not tell you that repeated visa renewals are impossible in Vietnam. I will tell you that building a 20-year retirement plan around the assumption that a short-term arrangement will always be renewable is a risk that deserves serious consideration before you sign a lease. The fix. Verify your specific legal pathway before you move. Don't assume. Talk to an immigration attorney who handles Vietnam specifically. Know exactly what legal basis you're living on before you ship your furniture. Thailand is a fundamentally different situation on this pillar, and this difference alone is enough to change the retirement calculation for a lot of people. Thailand has dedicated retirement visa categories. There are specific financial pathways, including a bank deposit requirement, an income requirement, or a qualifying combination of both, that are designed specifically for retirees. The framework exists. It has been used by thousands of American retirees. The infrastructure around navigating it, attorneys, expat communities, established processes, exists in a way that Vietnam simply cannot match right now. The problems are real too. The financial requirements tie up a meaningful amount of capital. The OA visa route has additional insurance requirements. 90-day reporting remains a feature of long-term life in Thailand that some retirees find genuinely burdensome. And requirements can change. Thailand's immigration rules have shifted before and will likely shift again. That last point matters more than people give it credit for. No immigration framework is permanent. Thailand's retirement visa has changed in structure and requirements multiple times over the past decade. Assuming that what exists today will exist identically in 10 years is the same mistake people make with Vietnam, just from the other direction. The difference is that Thailand gives you a formal framework to work within when changes happen. Vietnam currently gives you less to hold on to when the ground shifts. But here's what doesn't change. Thailand gives you a legal framework specifically designed for retirement. Vietnam currently does not. For a retiree thinking in decades rather than months, that difference is significant. So let's put all of that together. The rent, the food, the healthcare, the visa. 4 pillars, 2 countries, 1 budget. Here's exactly what the $1,600 verdict actually looks like. Let me make this as clear as I possibly can, because the whole point of this video was to give you an actual answer, not a list of considerations that sends you away more confused than when you arrived. Choose Vietnam if your absolute priority is keeping monthly spending as low as possible. If you're in solid health and don't anticipate needing specialist medical care regularly. If you're genuinely comfortable living locally, eating locally, and adapting to a culture that doesn't bend toward you. If you're willing to navigate a more complicated long-term immigration situation. And if your $1,600 needs to stretch as far as it possibly can. Vietnam gives it more room for savings, more room for emergencies, more room to breathe at the end of the month without watching your account and wondering if you calculated something wrong. Choose Thailand if healthcare access is a higher priority than monthly savings. If you want a retirement visa framework that was actually designed for people in your situation. If you have enough savings to meet the financial requirements that come with that framework. If you value the established expat infrastructure and English availability in medical settings. If you want the confidence of knowing that when something goes wrong medically, and eventually something will, you're in a country with the infrastructure to handle it properly. And if you can accept that your $1,600 will work harder in Vietnam, but your retirement will feel more structurally secure in Thailand. Choose neither if $1,600 is your only financial resource with no emergency savings behind it. If you require extensive ongoing medical treatment that demands specialist access. If you're not willing to adapt to a non-English environment in daily life. Or if you don't have enough savings cushion to handle the unexpected costs, healthcare, immigration, emergencies, that will come regardless of which country you choose. If I had only $1,600 coming in every month, and my absolute priority was making that money stretch as far as possible, Vietnam goes first. The monthly budget math is simply stronger. But if I were building a long-term retirement plan, thinking in decades, not months, and I had the savings to meet Thailand's financial requirements, I'd choose Thailand. The retirement infrastructure, the healthcare access, and the legal clarity of a dedicated retirement visa framework are worth the higher monthly cost for the retiree who's planning to stay. Vietnam wins the monthly budget. Thailand wins the retirement framework. And the gap between those two things is exactly what most cheap retirement videos never bother to explain. But here's the question that follows naturally from everything we just covered. What if you could keep a budget close to $1,600, avoid the language barrier entirely, and still live near the ocean? No visa complications built around tourist frameworks. No healthcare system you can't communicate with when it matters most. That's exactly what I looked at in my English-speaking island video, and one of the destinations on that list surprised even me when I ran the actual numbers. That video is on your screen right now. Watch it next before you decide where your retirement money actually goes.